Hello everyone, we are going to present a normal and abnormal chest X-ray which is part of cardiopulmonary assessment. Introduction. Chest X-ray is vital tool to rule out any cardiopulmonary abnormalities. By the use of regular chest X-ray, we can also monitor progress and the treatment of underlying pathology. In any traumatic case, chest X-ray is must performed to assess any severe cardiac and respiratory dysfunction. Patient is asked to take deep breath during X-ray. It will make more clean up to 10 to 12 reps. There are three projections of chest X-ray: antero-posterior view, AP view; postero-anterior view, PA view; and lateral view. X-ray projection is described by the direction it enters to the body of patient. In AP view, spine, scapula, posterior chest wall seen more clear. In PA view, heart, clavicle, sternum, trachea, and anterior chest wall seen more clear. How different structures seen in chest X-ray? Air as a black, bone as a white, muscle, fascia, fat, and skin are grey. Following structures are seen in normal chest X-ray: lungs, heart, trachea, clavicle, scapula, vertebrae, diaphragm, humerus, gastric bubble, aorta, breast shadow in female, and sternum and ribs. Lungs. Increase in density of lung field, focal or diffuse, are seen in the tumor, effusion, pneumonia, and emphysema. Decrease in the density of lung fields are seen in the bronchitis, bronchiectasis, pneumothorax, and emphysema. Heart. By the use of chest X-ray, we can comment on the underlying heart pathology. Diameter of the heart and diameter of the thoracic cavity ratio is called cardiothoracic ratio or cardiac silhouette. Normally, it is measured from center of the sternum to the either outer edge of the rib. Normal cardiothoracic ratio is 1:2 or 0.42 to 0.50. Greater than 15.5 cm in adult is abnormal. Boot-shaped heart in children suggests congenital heart abnormalities. Cardiomegaly is occurred in myocardial infarction, rheumatic fever, and pericardial effusion. Costophrenic angle. It is an angle formed by the diaphragm and the lateral border of the lung pointing downward to the abdomen. Normally, it measured about 30 degrees. Blunting of the costophrenic angle suggests effusion or pleural thickening. Diaphragm. Both hemidiaphragm is seen as dome shape on chest X-ray. In full inspiration, diaphragm ascend 6th rib anterior, 10th rib posterior, and 8th rib lateral. Right side hemidiaphragm ascend 2 cm more than left due to lever. Under the left hemidiaphragm, gastric bubble is seen. Low flat diaphragm suggests hyperinflation. Elevated diaphragm could be positional due to antero-posterior film, physiological due to lack of full inspiration, pathological due to abdominal distension, shrinking of lung above, and lung fibrosis. If one-sided hemidiaphragm is raised, lower lobe atelectasis, paralyzed hemidiaphragm, and excess gastric gas on left side. Right side subphrenic air is present due to after abdominal surgery and perforated gut. Trachea. Dark column of the air overlying upper vertebra represent trachea, which is in the midline down to the clavicles. It displays slightly right before branching into main bronchi. Any underlying lung pathology causes trachea to deviate on either side. In the consolidation, fibrosis, atelectasis, trachea is deviated to the same side. In the pneumothorax, pleural effusion, and emphysema, trachea is deviated to the opposite side.
Hello everyone, we are going to present normal and abnormal chest X-ray. Present picture is of normal chest X-ray. Following structures are seen in normal chest X-ray. First, trachea, straight black shadow overlying cervical vertebral column is a trachea. On the both the side, big black shadow represent both the lungs. Big white shadow between the two lungs is suggest heart. Clavicle, scapula, humerus, ribs, sternum are also seen in this picture. Both the hemidiaphragm is seen as a circular shadow. Right hemidiaphragm is slightly higher than the left. Under the left hemidiaphragm, gastric bubble is seen. Both the hilum of lung are seen in this picture. Aortic knob is also seen in this picture, which represent aorta. On the both the side, costophrenic angle is seen as a sharp angle, which represent angle formed by the lateral chest wall and the lower margin of the lung. Now we are moving on the abnormal chest X-rays. Present X-ray is of 65-year male diagnosed with tuberculosis. Abnormal findings are: first, homogeneous opacity in left upper lobe. Second, rise right hemidiaphragm. We can see here right hemidiaphragm is abnormally raised. Third, trachea deviated to right. Trachea is slightly deviated to right side. Present picture is of 29-year male diagnosed with lung abscess. Abnormal findings are: first, overexposed X-ray field. Increased black shadow of the bilateral lung suggests overexposed X-ray field. Second, diffuse opacities in right upper and middle lobe. Third, trachea deviated to the right side. Present picture is of 83-year male diagnosed with left side pleural diffusion. Abnormal findings are: first, thoracic scoliosis is present. Second, trachea is excessively deviated to the right side. Third, small amount of effusion is also present on the right lower lobe. Present X-ray is of 45-year female diagnosed with cystic bronchiectasis. Right side is greater than the left. Abnormal findings are: first, dilated bronchi in right side middle lobe and the lower lobe. Second, trachea is deviated to the right side. Third, invisible costophrenic angle on the both sides of the lungs. Present X-ray is of 24-year female diagnosed with TB. Abnormal findings are diffuse opacities on the both the lungs.